the importance of addressing what matters most to patients, and it is very important to me. Um, what matters most in healthcare goes beyond medical treatment. It is understanding what truly matters to each person and shaping care around their lives, not just their diagnosis. I learned this lesson firsthand in 2020 when I had just graduated from medical school, moved to the United States, and began my journey caring for some of New York City's most vulnerable older adults through my work at JASA, one of the city's largest providers of aging services. In medical school, I was trained to treat disease and preserve health. Yet, I quickly realized how little I knew about what happens once patients leave the hospital. Social determinants, daily challenges, and loneliness can profoundly affect recovery and quality of life. In 2021, I met a patient I will call Mr. Happy. He had recently been discharged after a prolonged hospitalization for a congestive heart failure exacerbation and ascites secondary to colon cancer. Reaching him was difficult since he was often unavailable, and the referring social worker warned me that he was hard to engage. When I finally did, he became both my teacher and my patient. My first aha moment came when Mr. Happy taught me the power of patience and persistence. After several attempts, he finally agreed to a visit. When I arrived, I immediately understood his hesitation. His apartment was nearly empty. During his hospitalization, his few possessions had been discarded. He had no chair, no linens, no clothes. He was angry and embarrassed. Through JASA supports, I was able to provide clothing, shoes, linens, and a recliner so he could sit comfortably. As we reviewed his medications, I discovered that he had stopped taking his heart failure medication because it was unaffordable without insurance. I contacted the manufacturer, obtained a coupon, and coordinated his pharmacy with his pharmacy. I'm sorry. Within hours, he had his medication in hand. We reviewed each prescription together using the teach back method and created a simple list he could follow. From that point forward, he took his medications consistently. This was my second aha moment, realizing that patients often labeled as non-compliant are in fact navigating real and significant barriers to care. My final aha moment came when JASA implemented the age-friendly health system framework, which centers on asking every patient a single transformative question. What matters most to you? That question changed my entire approach to care. For Mr. Happy, what matters most was regaining his health so he could spend time with his son and siblings and once again play chess in the park. Together, we worked to make that possible by arranging transportation, medication delivery, and homemade support, and by helping him secure insurance for ongoing care. Through this experience, I learned that true healing begins when we listen deeply to what matters most. Mr. Happy became more than a patient, he became a mentor. On my final visit, we played chess together, honoring one of the things that matter most to him. He reminded me that compassionate, person centered care, grounded in empathy and partnership, is at the heart of medicine. Um, Thank you. So that is my piece. So I just want to say, I am so lucky to have been able to move to the States and begin working with a big non-for-profit organization that is amazing with New Yorkers, JASA, and I feel very lucky. And interacting with the patients and being able to help them at their home, being able to understand what they're going through, what they're living, what their situation is, what their economy is, has transformed how I think about patient care. Usually, when patients leave the hospital, providers don't have a clue for the most part of what's going on at their house, and a lot of the times it seems like patients can be difficult, because they don't take their medications or they don't go to their appointments. But the reality is different, and a lot of these patients have a lot of challenges to be able to do these things, and these are real challenges. Some don't have money, others don't have insurance, and just being able to help them out with things that seem so simple as providing transportation or maybe just calling somebody and see how they're doing because they feel lonely has really changed my perspective. And I just hope that everyone could learn a little bit from this. Be patient with your patients and be nice. A lot of times we don't have a good idea of what's going on at their house. Thank you so much.